Hello, I'm Dr. Emily Hall, and I'm excited to introduce you to the WIMBA Way, a journey utilizing this advanced WIMBA technology for your patients. First, you're going to need clarity in what being a WIMBA provider really means. Then, you're going to get to know the WIMBA resources for the confidence needed to make the right decision for your patient, and then you will have the foundation of the WIMBA Way so that you will have confidence in your patient selection, device selection, WIMBA scans if needed, or measurements, the token decisions, and fitting assessment so that you and your patient will have the best outcomes. Then moving forward, you will be empowered to help even more animals that are good WIMBA candidates. As I mentioned, I'm a veterinarian. I'm also a certified canine rehabilitation therapist, as well as a certified professional animal trainer knowledge assessed. I've been a WIMBA provider since 2023. I started working for WIMBA last year, and I care for the clinical needs of WIMBA providers in North America, but I'm also very open to being able to help and have clinical conversations with providers around the world. I want to give you a little bit of background about me, just so that you know where we're coming from. I started in small animal practice for a few years before transitioning to zoological medicine. After some time with zoological medicine, I returned to small animal and started my own canine rehabilitation practice, doing mobile rehab in my community. And my big why that I want to share with you is my little girl, Kalina. She is the reason why I became a provider in 2023, and we'll be talking more about her closer to the end of this so that you will understand how you can use WIMBA, especially our WIMBA Go. But I also wanted you to know about the zoo background because we're going to be talking about behavioral aspects in VOP that are very important and why using positive reinforcement is important in the integration of VOP for best success. Success starts with clarity. So to get started, let's talk about the three main parts of VOP, which really starts with you, the provider. The training that you're starting right now, in addition to continued learning, as with any new technology, we need to keep up with so that we can do our best job. We do have a knowledge base that has many resources for you to have 24/7, and we'll be referring to that throughout this presentation. You, the provider, need to feel comfortable with the patient device selection. We're going to be talking about this a little later, but I wanted to point out that we do have a no-cost case consult, and this is available both online, on the app, and in knowledge base. This will go directly to our team, often directly to me, and then I will be able to get that back to you, usually in one business day. If it's a little bit more complicated, it takes about 2 business days, but you'll get a medical verification device report and the next steps that you need based on your case and based on the information that you share with me. Also, what we need from a provider is for you to then share your first dawning feedback and timely communications. We will be talking about this in more detail, but I wanted to kind of start the process of getting your mind on what being a provider really is, including that you're responsible for any warranty claim or purchase replacement process requirements, meaning that if anything is needed, your parent is going to go directly through you and not be able to go through WIMBA and around you. We are very focused on the providers being always in the know about their patients. To remember that WIMBA is a veterinary orthotic and prosthetic tool, and it requires applied skill set for the best long-term outcomes. So thank you for being part of this. Now we're moving on to the importance of the provider of this WIMBA, creating custom products based on your inputs within product constraints. What that means is that, for example, we have a variety of devices, and something like a WIMBA Go has specific measurements, and some things can be changed and some things can't. What you're putting in your measurements, we will talk about specifically in this presentation so that you understand what your measurements mean. When we have our WIMBA Pro they are based on a scan. And with that, there are some different things we can change, but especially for prosthetics, they can look quite different depending on the needs. So each product has a different level of customization to consider. The turnaround time with clear communication is always important as an expectation from any WIMBA provider. So WIMBA actually has this on their website with every device listed in a drop-down. You can see what the whole timeline should be for each device. And then accurate WIMBA provider only pricing is available on our knowledge base only for providers. And this is great because it means that you can select how you'd like to price your specific situation. For example, we have the device itself, reprint, and the different replaceable components. This is all ordered through you. Parents do not know the pricing. And so you will be able to create a package or upsell how is best for your specific situation. And then WIMBA stands by their stated expectations of device durability, which is in their terms and conditions and warranty sheet. A reminder is that WIMBA Go products and WIMBA Stifle Orthosis Pro can be ordered at any time, but the WIMBA Prosthetics Pro does require more discussion, and you need to reach out before promising that to your patient. Lastly, and very also importantly, we have the pet parents. The pet parents are a critical part of the 3 system of WIMBA. Pet parents are responsible for following your instructions and our pet parent guide. We do have a pet parent responsibility sheet in our knowledge base that you're able to use any way that you would like. And this sheet mostly is showing that they are to follow your instructions and what they can expect, and that also they need to be following their pet parent guide. It is important to remember that the WIMBA devices are going to be delivered to you, the provider, for fitting and follow-up care. So for continuity of care, the conversation needs to be had if your patient is going to move or if they think that we'll be able to send them direct parts. You need to remember that this is always through you for the safety of the animal. So now we're going to go through the WIMBA process. First, we're starting with what we're doing now. Starting with the WIMBA training, you are going to be, from here, looking at the knowledge base, reaching out to us with questions. We're always happy to help continue the learning process. Then we have the patient candidacy selection. We're going to talk about all of these things. I just wanted you to see kind of where we're going, where first you need to understand, then you need to see if this is a true candidate for WIMBA, what you can do once you've decided that yes, this is a good candidate for this particular device in your patient, and then what to do with that with our either WimbaSCAN or picture and measurements. Then this device will be designed and created, processed, and quality checked, sent to you, and we'll have fitting, integration, feedback, and donning media. So let's talk a little bit about patient candidacy. While I know that we deal with patient candidacy all the time in both veterinary medicine and canine rehabilitation, I want to go over some things that are sometimes overlooked in VOP, while it's actually very similar to what we do in our everyday practice. First, we ask, will the condition that's currently impacting the mobility be improved by the device? Do you feel confident, or is this a suspected diagnosis? For example, if this is a suspected diagnosis, do you need to do other diagnostics before ordering a device? If we have a swollen joint, have you looked at all the options before moving forward with a supportive device when it could be something that needs additional support? Do the currently available WIMBA devices support improvement for the diagnosis and the different planes of instability? For example, our WIMBA Go devices are only for one plane of instability, where our WIMBA Pro devices have more availability to help with different planes. Does the current WIMBA production shipment timeline to the correct fit meet the needs for the condition and treatment plan? Sometimes we have situations where we want a device, but we don't think about how much time this diagnosis likely leads us with. And so if that's something that you've decided and discussed with the parent, that's perfectly fine. But it's important to know these timelines, and they're available on our website, like I mentioned before. And I can't express enough how much I love to see your information on your case consultations. Like I said, we have it on our website, knowledge base, and app, and I'll be able to reach out and help you with the next steps. Second considerations are patient-specific. So after we've looked at the diagnosis and we know that, yes, the device itself will take care of the condition that we're talking about, likely, then we need to think about behavioral considerations. Is this patient one that's been known to have quite a few foreign bodies recently? Does it have a chewing tendency? This may not be a safe situation if you're constantly going to surgery with the pet for eating socks. So those seem funny, but it is important to have the pet parents understand the severity of their role in understanding their dog's behavior. This is also why we do not recommend having the patient wear the device without supervision, because even dogs that don't have a chewing tendency can find something different on their limb interesting to investigate with their mouth. Fear, anxiety, and stress thresholds are important to assess. It doesn't count them out of being a VOP candidate in any way. My little girl, Kalina, has a lot of fear, anxiety, and stress. But what we did was we created a plan to work on this with her for her success with her WIMBAs. With that, it is important to discuss this with the family to see if maybe sounds, pressure, what is your pet's specific situation, and then reach out if you have questions. Again, I do have a behavioral background, and I'd be happy to talk through any of those considerations also with you. Then we have the general specific patient considerations, like, is the dog done growing? What hair coat do we have? It doesn't mean yes or no, it just means there are things to think about. Long hair, short hair, it's going to change a little bit how you're going to be donning and doffing. Expected activity is incredibly important to be realistic with the family, to see what device is correct for the specific situation. And then, is there any additional compounding medical concerns? You need to remember this is just like all of our other situations. You need to think about the whole patient when you're thinking about adding a treatment plan that includes a WIMBA device. So third consideration, very important, is the family capabilities. Just like in general practice or your normal rehab, when we think about what we can do for treatment, we have to think about what can the family participate in. For example, in veterinary medicine, when we think about what medications to prescribe, we can't prescribe 3 times a day specific medication if the family cannot do that. So maybe we think of a different medication plan. In physio, we know that maybe there's a parent that can't do certain exercises with their pet. So we decide on exercises that work with the family. So the same applies here. You need to think about the physical and mental ability of the family to follow the pet parent guide and all other instructions for this to be used as a therapeutic tool. Also, financial ability for treatment plan is important. What I mean by that is there are short-term and long-term needs. Short-term is the device itself, but then long-term are those components that we know are going to, over time, have normal wear and tear. All of that, again, is in your pricing sheet that's specific for providers for you to decide the best way to move forward. The WIMBA Carpus Orthosis Go is the first device that we're going to be talking about. This device is a great preventative, proactive medicine addition for therapy. Carpal hyperextension, mild cases are where WIMBA Go excels. Things like osteoarthritis in the carpal joint, use for rehabilitation, especially for building muscle in senior dogs. Prevention, like I said, with tripods, for example, especially front limb amputees. We've had a lot of success with this being preventive so that that overuse of the weight on that front limb now has more support and they have less breakdown over time, as well as can go longer with their family out for walks. Also supporting obese dogs in their recovery. This is a tool. So these are things that you can do with the WIMBA Go to help those mild carpal hyperextension cases. Some key things to remember is that we do have a medical indications whole page on Knowledge Base that I highly recommend you go and look at. Reach out with any questions. But we need to be clear that this is not for your palmograde stance at any point in gait, no nerve damage, medial lateral instabilities, deformation or rebuilding of the joint. We shouldn't have fluctuation of joint size, the area near the brace, such as swelling that comes and goes. Skin exposure and wounds should be all healed before using this. This is not for 24-hour use and should follow the break-in schedule. So if you're wanting something that has very rigid stabilization that you can use post-op 24/7 for weeks, this device is not what you're looking for. This is for mild cases, not our moderate to severe cases. Similarly, with the WIMBA Tarsus Go, all those considerations are the same, no plantigrade stance. One thing to consider is that the WIMBA Tarsus Orthosis Go excels at tarsal hyperextension, and that is what our standard tokens are created for, mild cases of tarsal hyperextension. You can use our WIMBA Tarsus Go for tarsal hyperflexion, mild cases, if you use custom tokens to help stabilize in a different way. We'll talk about that in our tokens section coming up. And again, this is really helpful for our osteoarthritis, rehabilitation for senior dogs, and the amputees also appreciate the support. So for the measurements of the WIMBA Go, I want to talk about the different sizes and how to select which size is right for your patient, and then how to measure based on that size. So the WIMBA Carpus Go comes in 3 sizes, the standard, mini, and nano. And the WIMBA Tarsus Orthosis Go comes in 2 sizes, the standard and mini. For WIMBA Go, we have just measurements and 2 pictures. So let's talk about the sizes and briefly the measurements. I highly encourage you to go to our WIMBA Knowledge Base and look at our measurement guide there. WIMBA Carpus Orthosis Go comes in 3 sizes, our standard, mini, and nano. You will take 2 pictures, a front view and a side view. Our WIMBA Tarsus Orthosis Go comes in 2 sizes, the mini and standard, and for this you also take a front and side picture of the patient in normal standing angle. You will go to your knowledge base, or in the app now, you can actually directly get to the WIMBA Carpus Orthosis Go or WIMBA Tarsus Orthosis Go measurement cards. You start with the first measurements, X and Y, and this is how you decide what size you are going to be choosing. From there, you'd go to step 2 and measure according to the step-by-step guide there. Selecting tokens is a common question, so please do not hesitate to reach out. This is in Knowledge Base, and I highly recommend you look at Knowledge Base and then reach out. Tokens are described in maximal values of extension, not the actual range of motion. The digit that you see in the app shows to which point the limb will extend in the orthosis. When we think about this, 75 degrees is the minimal flexion point. So the flexion of 0 basically degrees isn't possible because the orthosis bends on itself. So when we're thinking about all of these combinations, it's important to remember that if we want to limit flexion and tarsus, you're going to need custom tokens. For example, like I mentioned, the WIMBA Go is great for mild cases of arthritis, where we want to limit the flexion and extension so that it doesn't hit the ranges that are uncomfortable and re-inflaming the joint, but at the same time, they still have range of motion, so we can build muscle and help support those joints over time. The great thing about tokens is you get 3 tokens, and so you can start at a more limited range of motion and build into more range of motion, or depending on your situation, you may have it go back and forth. And we're going to talk about how I use tokens with Kalina in her situation later in this presentation. Don't feel at all uncomfortable if you have questions, because this is what we're here for, so please reach out. Now we're moving on to our WIMBA Pro devices. Our WIMBA Stifle has a mini and a standard. Our mini does not have a tarsal component, it's just for the stifle joint, and then the standard size does have the tarsal component, but if you have a dog with a hind limb dew claw, you may want to consider just using the stifle only option. One wonderful thing about all of the WIMBA devices is that they have replaceable components more than any other in the WIMBA industry currently. That means that even our inserts can be replaced if you find that your patient has maybe, especially with a stifle, changed their muscling. You can purchase different size cushions to replace so that you can continue using the same shell, but to a point you can change the cushion, and that is a very big help in certain stifle cases where we've had a lot of muscle atrophy. For the WIMBA Pro, you will use your WimbaSCAN. That's your auto dolly and your mat, and I highly recommend you looking at our knowledge base for much material about how to do the WimbaSCAN appropriately, including our WimbaSCAN checklist. Now, radiographs are important. They're not required, but if you do have scaled radiographs, you can see the example of what view we are actually looking for, which may be different than your typical view when you're diagnosing. If you have any questions, as always, reach out. You will need 2 perfect scans, and you can put both limbs on the ground if you adjust them so that they are in a staggered position and you can still see the groin, which is very important because we need to see all the way up into the groin to see how high we can place that for the most accurate device. You will also need goniometric measurements, and these are in knowledge base as well as on the app. We're talking about the token selection. There are different tokens for mini and standard. This is something where you can decide normal, mild, moderate, severe, or you can do custom. If you're doing the mini stifle, then you would put the tokens you want in the note section when you order. For the standard size, then you can just select in the app as is, and remember, you are allowed to use custom tokens. Using your goniometric measurements can help you decide what tokens are right for your patient. We also have a wide range of prosthetics. I won't spend too much time on it because I would love for you to go to both our knowledge base and our website that has even more information. But depending on what your patient's limb length is, in addition to how they're moving and so much more, we then decide if your patient's a candidate together, then what other additional information we need, and then we can talk more about the process. And what the typical process looks like is that you would order via our WIMBA app, and the stages begin where you start with your initial deposit. Then you get your first prototype in 20 working days. You give us the feedback on that prototype. From there, you will get a second prototype in 20 working days from the time of getting the full feedback needed. After that, you may need an additional prototype. That would be an additional cost, or most of the time, we have then our final prosthesis. Once we get your final feedback, it's 20 working days from those final feedback submissions. Then you have the delivery, and we're going to talk about all of the fun integration and feedback needed for that later. Now, we do have the WIMBA app, and if there is any trouble that you have, I wanted you to have this slide so that you could refer back to it for what to do. What I want you to get out of this right now is the best thing to do is stay calm, log out, log back in. When it's time for your WimbaSCAN day possibly, or your measurements, the best thing to do is first check that you have the most updated version of the WIMBA app. Then, like I said, you're gonna just log out and log back in. If your password isn't working, use the reset password option, and make sure to put more information in the notes before you're submitting. Report any issues you're having to help@wimba.vet. With WIMBA Pro, like I mentioned, we have WimbaSCANs. And with WimbaSCANs, that is a new technology for you. And so it's normal to have some learning curve with that. So we've created a WimbaSCAN report that can be requested for Pro orders in the notes section. So just let us know that you would like a WimbaSCAN report, and we will create specifically off of your scan specifics of how you can maybe improve for the next time. This is really important because what you submit does directly help create what you're going to receive. And so as you're continuing with building your confidence with WIMBA, having better and better scans will help you and your patient. Now you've submitted these perfect scans, and it's time for WIMBA to get going. They're going to be doing so much more than what printing sounds like. WIMBA has their own printing facility that have direct quality control access, as environmentally friendly practices are balanced with maintaining the best quality products. There are different components that have different print and post-processing needs and times, and each component is checked by the WIMBA team before being packed in our in-house facility. The WIMBA team is directly handling and carrying all the components that make up your patient's medical device. In addition, I'm very excited to share that packed with love are these eco-friendly peanuts that you can actually use water and they will degrade, so you can make it compostable and you do not have to increase the landfill. Fitting the patient is an exciting time. Once the WIMBA device is sent, you will receive a UPS tracking number. You will have a product manual. There is much media for you to review, such as donning videos, examples of what a good fit is. And as you can see here, we do have 2 examples of the WIMBA Go. WIMBA Go is important to remember that the inserts should make contact with the limb in all phases of gait. It is also important to remember that the black areas, the struts, are not touching the limb, and the token should not directly be touching the limb. Of course, as always, we need to have media to know how things are going and to assess this treatment plan. So we do have required media where we need a clear picture of the orthosis fit in the leg from at least 2 views, a video of donning, a video of the patient controlled walking or at least shifting in the orthosis or prosthesis. We understand that sometimes, especially with a prosthesis, they can't fully walk in it, but even weight shifting is important for us to see how things are fitting for the device. And then a video of doffing. Now the video of donning and doffing are also really important for you. you're going to be able to send that to the pet parents, because yes, we do have a general donning video, but every pet's different. And as you know, pet parents need to be putting this on perfectly each time. WIMBA has additional component videos for you to view, how to use the different components, change out the components, and then there may be additional information for any specifics. Like, for example, some patients need reinforced tokens with TPU plugs, and you will get an additional handout for that if you're receiving those special reinforced tokens. Now the WIMBA device is delivered and it's your time to shine. You get these 2 sheets in your package. One is specifically made for you, the provider. It has the checklist for you to see what is in your box. That packing list is important for you to be familiar with and check before your actual fitting, and reach out as soon as you have any questions, including if anything is for some reason not there that you expected. The primary plan of the day, like we talked about, is obtaining that donning video and other media to assess and share with WIMBA within 10 days of receipt to help@wimba.vet. We will need to integrate and continue with patient care, and we have a patient-specific family sheet that you will hand to the parents that has their pet parent guide and a QR code and explains what you'll be doing with the fitting, getting the media, and help them understand how they'll be supported throughout this process. What's expected from pet parents is that they do take that sheet home and they are going to be looking at that pet parent guide and communicate with you, the provider, for the continued care. Now, when we're talking about helping an animal adapt to their orthosis or prosthesis, we have a lot to consider. And I want to go through this with you to help you understand the complexity that sometimes can be there, but also empower you to see how you can make a huge difference in their lives by taking it slow and using behaviorally appropriate methods. So to start, you're going to have a gradual introduction to the orthosis. Not only for the skincare reasons, but for behaviorally, it's important to start with short wear sessions initially. Then we're going to be slowly increasing the wear slowly over time. And you need to remember that even if they were able to do some new activities before they started wearing the device, you need to go back to limiting activities slightly while they're wearing the device until they've built up this introduction. We don't want them to be having an abnormal gait just because they're not used to something that can create more compensatory issues. So please control the activity a little bit more at the beginning, and then as they're getting used to the device, you can increase the controlled activity as appropriate. Watch for body language signals. Encouraging positive reinforcement's important. But if they're not taking the treat and you know they normally like treats at your facility, you need to stop and remember that this is an actual fear, anxiety, and stress threshold, that they're showing you signs that they're not comfortable. We need to back off and reassess. Please reach out if you have any questions about how you may better reassess your integration plan. I'm always happy to help. Ensuring comfort and compliance, we need to monitor for that skin redness, irritation, any discomfort, and just the fit as needed as the integration continues. And for steps on integration of the orthosis, you need to have a high reward at first when you're just pairing the device with the pet. When you don the pet, you can have an incremental introduction. And what I mean by that is that, for example, I didn't start with my dog just putting the device on her and expecting her to immediately do all these rehab exercises. We started with her just getting treats for it being around. Then we gave her reinforcement for staying still while we put it on and just took it off immediately. Then she moved forward with getting to put it on, do some movement, and then take it off. So that's what I mean by the gradual introduction and pairing it with reinforcement. So as you're pairing this with reinforcement, then you're going to have functional transitions and tasks to make sure that they're actually using the device in those important transitions without creating other inappropriate compensatory patterns. For example, if your patient isn't fully integrated yet and they're running, that could be very serious because they could create compensatory patterns that do harm to other joints. So what we need to remember is that we are positively pairing with functional transition and tasks and only graduating them to next steps as appropriate and as we're seeing consistent success. Then we can decrease the rate of reinforcement and increase those other rehabilitation exercises. Now, I want to take a moment and explain a little bit about how I used the tokens with my dog, Kalina. So a little background is that she did tear her cruciate. She was a senior, and she is a hind limb amputee. She lost her hind limb when she was young. So she's been without her other limb for a long time and was already in rehab for compensatory issues as a senior. Then she tore her cruciate and was having serious carpal hyperextension issues. So much so that her quality of life was in question and next steps were looking quite concerning. She didn't enjoy going outside anymore because posturing to go to the bathroom with all of her weight on her front limbs were now creating serious pain in her joints. So when we got our WIMBAs, we put them on with a more restrictive token so that she had pretty full support when we were going to the bathroom and coming back inside. With just that change, her whole demeanor improved. She felt supported. They were lightweight, they were easy for her. She could flex, which is something very important to her. She likes to be able to flex her wrists. And so this was something that was the starting point of the upward spiral. And once we were getting her mentally more positive, then we could start her rehab again because she would now take treats again and now be interested in our rehab exercises. So what you see first in this video is the pink tokens. Those are the 195, and that's actually our more extensive range, but you'll notice that I just have her sitting there because her hind limb is not ready for even standing at this point in her recovery, but I wanted to build the muscles in her carpus. So we're doing this particular exercise, and because the tokens are so easy to change out, I was able to specifically change from really strict for the backyard time to 195 degrees, which is more of a normal range, so that we could build her strength with appropriate exercises without doing any damage to her hind limb. Now, the next videos are much later in her recovery, and you can see that we've moved to our light blue tokens that have a little bit less range than the beige, but have more range than our more restrictive tokens. And now she's able to do her rehab exercises to keep her back leg strong, her core supported, and now she enjoys life again. So, as a reminder, we have the WIMBA knowledge base. This is for providers to have 24-hour access to so much information for continued learning. This is kept up to date constantly, and we hope that you continually check back in with it. There's a search bar at the top that I highly recommend you use, and navigating is actually quite simple when you use that search bar. Now, we also have a wonderful WIMBA team that's here to support you with any of your specific questions, and maybe you can't find something in knowledge base. We're happy to help guide you. So just reach out. If you have any fittings, measurements, anything that you'd like us to actually virtually be present for, all you need to do is let us know in advance and we can schedule to be virtually present to support you. Thank you so much for being on this journey with us. We're deeply committed to WIMBA's mission and working with incredible providers like you who are at the forefront of innovation in veterinary care. Together, we can make a transformative impact on the lives of animals and their families. Thank you so much for being part of this journey, and please reach out with any questions.